Hi, my name is Savannah Parisi. I'm a student nurse at the University of South Alabama, and I will be performing the medication administration checkoff. It's my ID. Now I will scan the room. All right. Alright, so I have my patient care order form right here and my MAR. Alright, so the first thing that I would do is verify the order. So I verify that on the patient care order form and the MAR. So the order is morphine sulfate, 5 milligrams IM every 4 hours, PRN pain. Morphine sulfate, 5 milligrams IM every 4 hours, PRN pain. I would then verify and identify the 5 rights. That's my patient's name, the name of the drug, the dosage of that drug, the route, and the time I will give it. So Jaguar Jones is my patient's name. Jaguar Jones is my patient's name. Morphine sulfate is the name of the drug. Morphine sulfate. The dosage is 5 milligrams. Dosage is 5 milligrams. The route is IM. The route is IM. And the time is every 4 hours. Every 4 hours. After doing that, I would also verify the allergies that my patient has. So my patient is allergic to penicillin. My patient is allergic to penicillin. After doing that, I would perform hand hygiene. After performing hand hygiene, I would grab the correct vial full of the medication I need. Which is morphine sulfate. Show that to the camera. Where morphine sulfate, I will compare that to the MAR and make sure it is correct. So morphine sulfate, morphine sulfate. I will then look at the expiration date, which is December 20th, 2025, which means it's not expired and we can use it. After identifying those things, I will identify the route, which is IM, and I will identify the time we will give it, which is every 4 hours. And then I will also calculate the correct dosage. So it's asking for 5 milligrams to give to the patient. And on here it says it's 10 milligrams a milliliter, which means we would give the patient half of a milliliter. After doing that, we will make sure we have the right supplies. So I have a 3 milliliter syringe, a blunt fill needle, and a 23 gauge 1-inch needle. I will then, the first thing I will do is take an alcohol swab and clean the top of the vial. After cleaning the top of the vial using sterile technique, I will grab the blunt and a liter. Alright, take the cap off. And I will take out the equal amount of air that I would for the dosage, so half a milliliter of air. I will insert it, push the air in. We'll then take out. You can take out more than half. So when you are making sure you have no bubbles, you have the correct dosage. All right. and then you can go back up to your correct dosage. All right, once at your correct dosage, you can take it out. And we use the scooping method. After that, I will then attach the needle. Which I'm having difficulty removing. Alright, and then I would attach the needle. And I would dispose of this in the sharps container, which I have right here. Alright, after I will then show you, it is at 1/2 milliliter. 1/2 milliliter. There are no bubbles. All right, after doing that, I will check with a second nurse and have her verify that my calculations are correct, if indicated. I will look at my MAR and verify that this is correct. So morphine sulfate, 5 milligrams IM every 4 hours, so 5 milligrams. And my thing said 10 milligrams a milliliter, which means we would administer 1/2 milliliter, which is in this vial, for 5 milligrams. All right, after doing that, I will verify and identify the 5 rights again. So my patient's name, the name of the drug, the dosage, the route, and the time I will be giving it. So my patient's name is Jaguar Jones. On the MAR form, patient's name is Jaguar Jones. The name of the drug is morphine sulfate. The dose is 5 milligrams, or 1/2 milliliter. The route is IM, and the time is every 4 hours. I will then prepare a sticker that I will put on my now filled with medication syringe. It has my patient's name on it. It has the name of the drug that is on it, and it has the dosage. So it says Jaguar Jones, morphine sulfate, and it says 5 milligrams or 1/2 milliliter. I would then go to my patient's room. I would perform hand hygiene, and I would identify my patient using 2 identifiers. So I would take my MAR and my syringe with the tape that I took with me to the room, and I would use those 2 identifiers. So this is my patient's hand. So my patient's name is Jaguar J. Jones. Jaguar J. Jones, his date of birth is 08/25/1963, 08/25/1963. His MR number is 417-6352, 417-6352. All right, and after I do that, I will verify the allergies that my patient has. So he is allergic to penicillin. Allergies, penicillin. And I would ask my patient about that. I would say, Jaguar Jones, I see that you are allergic to penicillin. What are the reactions you get when you are given penicillin? I would then verify the 5 rights again. So my patient's name is Jaguar Jones. Jaguar Jones. I am giving him morphine sulfate. Morphine sulfate, 5 milligrams, 5 milligrams / 1/2 milliliter. The route is IM, and the time is every 4 hours. All right, after I do that, I will explain to my patient the procedure I will be doing today. Jaguar Jones, I will be giving you a 1/2 milliliter shot of morphine. It's going to be in your hip area. It's going to relieve your pain. I will then heighten the bed to a working position. I will lower the side rail. I will perform hand hygiene, and then I will put on my gloves. And my goggles. After doing that, I will position my patient and I will expose only the injection site. This injection site is the ventral gluteal. I would locate this using the greater trochanter on the patient and the anterior iliac crest. I would form my hand in a V shape, and I would assess the skin, looking for any bruising, and identify that it is good muscle. I will then take an alcohol swab and clean the incision, the injection site. And I'm not going to give the patient the medication in this hand formation. So I'm going to point my alcohol swab towards where I want to put the needle in. After doing that, I will grab my needle, remove the cap, and dispose of it in the sharps container. I will pull the skin so it is tight, and I will inject the patient. I will pull back and aspirate for the blood, and then slowly inject the patient. I will pull the needle out and apply slight pressure, dispose of my needle in the sharps container. I will not massage my patient. I will just put slight pressure. All right, after doing so, I will dispose of that. I will recover my patient and reposition my patient comfortably. I will raise the side rail. I will lower the bed back to its position. I will dispose of my gloves properly, and I would perform hand hygiene. I would then assess my patient for any allergic reaction. After doing that, I would go to my MAR and I would record my procedure. And I would also record my patient's reaction overall to the medication they were administered. And then I would go back later to check up on my patient. Yeah, I'll go back later to check up on my patient. We would do this, for example, with pain medications like morphine. And that completes my administration medication checkup.